But what does the Labour Party make of it all? Let's talk to the Shadow Health Secretary, Wes Streeting, who joins us now. Good morning to you. I mean, you've been one person who's talked about the need for reform in the NHS. I mean, this is billed as the most radical reform that the NHS has seen, in terms of staffing at least. Do you welcome it?
Well, for almost a year now, I've been urging the government to adopt Labour's plan to deliver the biggest expansion of NHS staff in history, doubling the number of medical school places and much more besides. And I wait to see the detail of the plan, but it looks like they've done it. So I'm not going to come on your programme this morning and say, I can't believe the government have done this thing that I've been urging them to do. We desperately need these staff. The one thing I would just gently say to Steve Barclay and Rishi Sunak is, why do we need the biggest expansion of NHS staff in history? Why do we have such an understaffed NHS? It's because over the last 13 years, we've not had a workforce plan. It is the biggest expansion since the last Labour government, which delivered 75,000 more nurses and 44,000 more doctors. So, look, better late than never to some extent, but I'm afraid one of the reasons why we've got the longest waiting lists in the NHS's history and the lowest patient satisfaction ever is because we have an understaffed NHS, and the staff that are in the NHS couldn't be working harder. They're slogging their guts out. One of the reasons they're feeling pretty miserable is that their best isn't good enough because there simply aren't enough of them, and that's why as patients we've all been feeling the pressure on the NHS and waiting longer than ever.
Yeah, I mean, it puts you in a bit of a difficult position, because if the worst stick you can beat them with is that it was your idea all along and they should have done it sooner, then basically you're saying this is good and we should welcome it. Maybe you should put your back behind it too.
Look, to be honest, Anne, I'll wait and see the detail later today, but based on what I've seen so far, absolutely we'll be supporting it. I mean, it doesn't cause me too many difficulties, actually. I mean, one of the things that hopefully people are getting used to now is that we always say Labour's policies will be fully costed, fully funded. Our plan was funded by abolishing the non-dom tax status. That's the one bit of our plan that the government don't seem to have adopted. You can ask Rishi Sunak why he's not keen on abolishing the non-dom tax status. But what that potentially does is free up the money we've committed to this to spend on other priorities, other Labour priorities, other people's priorities, because I think because the public finances are in such a mess at the moment, one of the processes we're going through as a Labour Party at the moment that wants to be in government after the next election is looking at what we can afford, not just what we want to do, but what we can afford. And there are lots of good Labour things we would like to do that we can't be sure about because the money isn't there. So if the government's found another way of funding the biggest expansion of NHS staff in history, actually what it does is potentially free up quite a bit of money, because we committed £1.6 billion a year to this, frees up that money to spend on other things that would make a really big difference to people. So actually, for once, in terms of the government's plan, I'm not necessarily knocking it. I'm going to look at the detail, pore through it, go over it with a fine-tooth comb to make sure the numbers stack up, that we can deliver it. But if it stacks up, and I genuinely hope it will, actually. I mean, I've been calling on the government to adopt our plan for almost a year now. Really hope the numbers stack up, really hope it will deliver what we need. And that will actually give me and the Labour team the chance to look at what else we might be able to do should we win the next general election, which obviously we hope to do.
Where does that leave the plans that you'd talked about over the last year in terms of... Okay, I mean, because let's be honest, you've been more radical in what you say the NHS needs in terms of reform than actually any other party. Perhaps you're the only one in a position to be able to do that, really. So where does that leave those plans? Do you still need those other radical reforms that you've already talked about, even 100%. With this in place?
Yeah. Completely. I mean, I've been saying, and I'll keep on saying it till I'm blue in the face, it's investment and reform that's needed to build an NHS that's fit for the future. If we just keep on pouring more money into the NHS as it is, we will continue to have some of the worst outcomes amongst advanced economies. And let's be honest, looking at the state of the NHS, the service, the outcomes most crucially, this is not the envy of the world at the moment, but it could be. The only way you do that is by not just delivering more staff, the biggest expansion, which is important. That's been a key plank of what Labour's been calling for. You've got to shift the focus of healthcare out of hospital into the community, fixing the front door to the NHS with better access to general practice, more community pharmacy and care in people's homes. You've got to make sure the NHS isn't just an analogue service but a digital one. This country's got amazing strengths in life sciences and medical technology. We should be at the cutting edge of that revolution. And also you've got to focus on prevention and promotion of good health, not just treating sickness. If we do all those things, the NHS will be there for us for the next 75 years, free at the point of use, there for us when we need it. But at the moment, that's in jeopardy because it's going through the worst crisis in its history. And money is important, as is staffing. That's why I hope the government's plan stacks up, and I think it will because it looks remarkably similar to our plan. But we've also got to deliver the reform, and that's what I learned looking at the last Labour government, which delivered the lowest waiting times and the highest patient satisfaction in history. We weren't perfect, we didn't get everything right in government, but my goodness, when it came to the NHS, we really delivered the best outcomes the NHS has ever seen. We did it before, and we'll do it again.
Can I just ask you, I mentioned this earlier on in the programme, but one of our viewers and listeners, Andy, got in touch, and it's ideas like this. I don't know if this is practical or not, Wes. You might. He says the problem with the NHS is the way it's managed. Managers should come from the ranks, people who understand the job and would not waste money. It's not a bad idea, is it?
No, it's not. I want to see more career progression for people from within the NHS workforce. Interestingly, one of the things that I found, I've said some pretty controversial things, almost sacrilegious things in the last year. I've said the NHS isn't the envy of the world, that it's a service, not a shrine, that what matters is what it delivers. And the interesting thing is, I've taken some political knocks across the spectrum, but I've been fascinated by the number of NHS staff who've been in touch saying, you're absolutely right, I see the inefficiency on a daily basis. You have no idea how bad our IT systems are. You have no idea how much paperwork we have to fill in, how much we're relying on paper, how much we're relying on pages. And the people who understand the NHS best are the people who work in it. And they know that it needs to change, and not with a big top-down reorganisation and some of the mistakes that this government's made in the last 13 years, but those practical changes to the everyday practices that NHS staff are lumbered with. And, patients can see it too. How many of us have had those letters through the post telling us about an appointment that was cancelled, that was the day before, and we'd already turned up and it wasn't happening. I myself turned up to receive scan results, only to be told they weren't ready. There's so much of that waste and inefficiency on a daily basis. It's not the fault of the staff, it is the fault of the creaking bureaucracy, and we've got to shake it up. And actually, some of my biggest supporters on that are the people who work in the NHS because they see it on a daily basis.
Now, there may be enough people, we never know, who might vote you in next general election, but looking at this plan from the Tories might wonder whether that's the right thing to do. So are you prepared to pledge that you would go with at least the bits that you like of this plan?
Yeah, and I'm going to look at the detail of the plan today. But as I say, it looks very much like our plan. And I'm not going to... I've literally spent the last year pretty much saying, adopt Labour's plan, we'll cheer you on. Well, it looks like they've adopted Labour's plan. So I'm not going to knock them for doing that. I'm going to have a closer look at the numbers and the detail today. But this looks to me to be broadly, if not in some cases, literally in exactly the same place as Labour. And all I gently say to your viewers, many of whom I know pretty fed up with politicians and still cynical about the Labour Party, next time you have the Tories coming on your programme and saying, oh, these, can't trust these Labour politicians, they're not fit for office, just remember that when it came to solving the biggest crisis in the NHS's history, which they caused, the Tories are looking to Labour to answer, and I'd appeal to your viewers to do the same at the next general election and give change a chance, because looking at the shower that we've had on the economy, on the NHS, our public services, surely we can't do a better, worse job than this lot, and it's time to give change a chance.